And so once again, we have Ms. Sylvia Lemus, who is representing the County of Sonoma, here to update us as to what's going on with COVID. And then you're going to give us this positive news about the vaccine. But let's get started with those numbers.
Yes, thank you for having me, Rafael. So first of all, we'll start with where we are right now with COVID. So right now, as far as vaccinations, we have 82.4% of the eligible population fully vaccinated, and we have 6.3% partially vaccinated. So partially vaccinated is people that have only received maybe one dose of the vaccine but haven't completed the whole process. So we want to encourage people to become completely vaccinated. And also our a percentage of people that have received boosters, we have 64.9% of the eligible population. Again, that means that we could have 100% of the population is eligible vaccinated, but we don't yet. So we want to encourage people that may have been vaccinated but have not received their booster, but they're eligible to please get your booster so you can become completely vaccinated. Right now, our metrics here in Sonoma County, our daily case rate is 35.8 per 100,000 residents. In the unvaccinated population, it's 56.2 per 100,000. And then the vaccinated population is 32.2 for vaccinated per 100,000. So there's a big difference. And the average again is 35.8. Our overall testing positivity rate for COVID is 14%. And then the lowest HPI, the positivity rate is 15.6%. I do have some data also about the hospitalizations. So right now we have about 35 COVID-related hospitalizations in our local hospitals this week. And then out of those, 4 are in ICU related to COVID. So we have 4 patients in ICU in the county related to COVID. And also some really good data to kind of keep mind of is that for cases, people that are unvaccinated have 2.7 times more likely to be affected with COVID. In hospitalizations, people who are unvaccinated had 15.2 times more likely to be hospitalized with COVID if they're unvaccinated. And then people who are unvaccinated have 13.5 times more likely to die of COVID-related situation if they're unvaccinated. So we want to really try to encourage people for their own protection to be vaccinated.
Definitely. And so again, some adults may choose and have the right to not vaccinate if that's what they choose to do. But what my concern often becomes are children. Children may not know better. And even when they do and they say, I want to get vaccinated, some parents are like, no, because you're under the age of 18, I'm going to prevent you from getting vaccinated. And I think that is traumatic for some of the children. Especially now, some of the summer programs are requiring some of these kids to be vaccinated in order to participate. And because the parent has chosen not to vaccinate their child's experience ends up being a negative experience because they're not able to participate. But we need to, again, protect the larger community. And so, again, parents, do it for your own health, do it for the health of your children. And again, that brings us, I think, to this positive conversation in regards to what is happening with the vaccination
Yes,
regulations.
we have some good news this week. As of late last week, the state and federal regulators approved the COVID-19 vaccines for children. Young children aged 6 months to 5 years old can now get vaccinated. So that's really positive news. We know there's been a lot of families that have been waiting for this time. So we estimate that we have roughly about 21,000 children here in Sonoma County that are eligible now to be vaccinated. And we are really encouraging parents that if they have a primary care provider or go to a health center to make contact with them and make an appointment to go and get your child vaccinated if you have it. For those that don't have coverage, we do have other options. They can either go to myturn.ca.gov and make an appointment at a local pharmacy for vaccinations for their children. Or the Roseland Community Center here on Sebastopol Road also has vaccinations for children 6 months and older. So that's really good. And I've heard that it's walk-in, you don't have to make an appointment. I heard from someone today that there was no line. They were able to take the 12-month-old child to go get a vaccination today. The Roseland Community Center is open Tuesday through Saturday from 9 to 4, except for Saturday from 9 to 1, but that's another option. So yeah, we're really excited about it. And the dose is different. I can talk a little bit about the dosing. So the Pfizer The Pfizer, which is available for children, we received 1,600 doses of Pfizer here in Sonoma County, and we received 1,600 doses of Moderna. The Pfizer is administered in 2 shots, 3 weeks apart, followed by a third one at least 2 months later. And each of the doses is 1/10 of the adult dose. So it's not a full adult dose, it's different. And it was tested and assessed over the years, last few years of the pandemic. So it's only 1/10 of the adult dosage that the children are getting. And the Moderna vaccine is a 2-shot series given 4 weeks apart. And that one is a quarter of the adult dose. So there is a difference, but like I said, there's been a lot of testing involved in that. So we are working with our clinics locally to provide free vaccinations to children. And so they're available on myturn.gov with their healthcare providers, the clinics, and also the Roseland Community Center.
Definitely. So again, there is no reason why you wouldn't be able to provide your child with a vaccine, whether it is the 6 months to 4 years of age, whether it's the 5 to 11, whether it is the 12 to, so on and so forth. All of these places have it. Your doctors have it. The Roseland one has it. And again, it's just about taking that step of protecting your family, protecting your children. And we also want to remind people that we had that holiday a few weeks back, and we have this upcoming holiday of 4th of July, at which time many individuals will be traveling. Many individuals will be traveling outside of the county, but many individuals will be traveling to our county from many different places. So we invite you to keep in mind to stay safe, keep your distance, and of course, wear that mask everywhere, whether it is a restaurant until your meal is served. If you're going to stay at the restaurant after the meal is served, and you're just going to be chit-chatting, put that mask back on, protect yourself, and minimize exposure. Eat outside, even better. Or again, if you're going to go to the store, again, there are some people out there who have COVID. They have chosen not to get vaccinated, and they are just spreading the virus in many different places. And so if they choose to do that, then we need to choose to protect ourselves. As I keep reminding everybody, imagine yourself in an airplane. There's turbulence. The airplane is moving around. The oxygen masks come down, and you put the oxygen masks on you before you put it on your child or anybody else. That's kind of how this works. So wear the mask, protect yourself, put the mask on your children appropriately, make sure that they're okay, and that way we don't have to worry about that. So essential. And then the other piece is just a reminder, there's still free places to get COVID testing. Please call 707-565-4667, 707-565-4667, or go to socoemergency.org/test, and you'll be able to find all of the locations for the upcoming week and future clinics.
That's correct. Yes, and so there's testing available still in the community. And in addition to that, Rafael, people can also have tests mailed to their home. So if they go online to covidtest.gov, they will get a free test sent to their home. And that's another option that they can use. And in addition, when people are testing at home with the antigen, the rapid test, we ask that they please report the results, because it's important for our community to have accurate results for our whole community. That way we know where our real case rate lies and our case positivity. And you can do that also on socoemergency.org. There's a place where you can report on there on an online form the results of your test.
Definitely. So again, we want to have the most accurate number. So if you took the test, you tested negative, still report it. That way we have that information. And so with that, as always, I want to thank you. Thank you for always keeping us updated, giving us the accurate information. This way it's not about, oh, my cousins, sisters, brothers, nephew said that, right? But we get it directly from our local government. So thank you as always. Ms. Sylvia Lemus for coming over and spending time with us. I hope to see you in the near future, maybe in the next couple of weeks, depending on the report. And by then, probably you'll have information based on the July 4th, holiday, where I'm expecting a spike once again. That
usually happens, right, during gatherings, yes. And we want to just make sure everyone's protected and just follow all the safety protocols, yes.
Thanks again. You take
Thank you,
care now.
Rafael. Okay,
All
see you
right.
soon. Bye-bye.
Bye-bye.